Hello, my name is Miriam Sada Marlin. I'm a nurse practitioner student from Maryville University, and today I will be performing my head-to-toe examination on Michelle. Hello, Michelle.
Hello.
How are you today?
Good. How are you?
Great. Now, Michelle, could you please state your full name,
Michelle Bidon,
your date of birth?
1/28/76.
Thank you. Michelle has emptied her bladder prior to the exam. I measured her height, weight, and a complete set of vital signs. She has also had a Snellen test performed for distant vision, and it was 20/20 with corrective lenses. And Michelle was alert, oriented ×3, and dressed appropriately for the weather. I have also performed hygiene and washed my hands prior to the examination. Now I will proceed to start her skin assessment. I will be doing the skin assessment all throughout the exam. Okay, Michelle, if you don't mind, I'm going to look at your face. Your skin is smooth, even. There aren't any rashes or anything. It's symmetrical. Your nose is midline. Your lips, could you please open a little bit? Okay, your lips are slightly dry. There aren't any fissures, no bleeding noted on the lips, no ulcerations. And what I'm going to start doing is trying to complete the cranial nerve exam. For cranial nerve 1, the olfactory, Michelle, I'm going to have you close your eyes, please, and pinch one of your nostrils. Could you please tell me what you smell?
Peppermint.
Good. And your other nostril, what do you smell?
Peppermint.
Very good. Your olfactory nerve 1, cranial nerve, is intact. Okay, and we already talked about cranial nerve 2. We performed the Snellen chart, and she had 20/20 vision with her corrective lenses. And also she did the Rosenbaum chart, and it was also for near vision. It was vision was 20/20 with corrective lenses. We're going to go ahead and do some more testing on your eyes. I'm going to do some extraocular eye movements. If you could please follow my finger, Michelle, with both eyes. That's good. And I'm just gonna, eyelids. Those are for cranial nerves 3, 4, and 6. And they are intact. Your movements are intact. And then what I'm going to do, Michelle, I'm going to shine the light into your eyes to see. You could look straight ahead, please. I'm going to check your pupil reflex. Okay, the eyes dilated with the light. And I'm going to have you look straight at the wall, please. And when it comes near your eye, I'm just going to see how your eyes are. I'm going to do it with my finger. Okay, great. You don't have any strabismus or anything else like that. And I'm also going to have you cover your one eye, this eye, and I'm going to cover my opposite eye, and I'm going to just have you look. Okay, look straight ahead at my nose. Okay, now do the opposite eye, and I'll do the opposite one of mine. Look straight ahead, and there's no problem. Your movement is fine. Thank you, Michelle.
You're welcome.
Okay. And then next, I'm also going to Look, it's called a red reflex into the eye. I'm going to get up a little closer in your eye and look at your vessels and arteries in the eye. It seems like you're a bit sensitive to light. Okay, I'm just going to look up it. Okay, I do see the red reflex. I see the arteries and veins, the cone of light. I don't see any cataracts. Okay, it looks pretty normal. And then I'm going to swing around. Is the light bothering you a bit?
A little bit.
Okay, I'm going to swing around. I should be at a 15-degree angle. And again, I'm looking inside your eye. I see the vessels, the cone of light, and the arteries. I don't see any cataracts, and it looks intact. Thank you.
You're welcome.
And then for the next one, I'm going to look at your lacrimal ducts. Okay. Okay, there's no swelling. I'm looking also at your lower eyelids. They're pink and moist, and if they were pale, that would be an indication of anemia. You do not have any lipid deposits in your eyes, which would be yellow, and that's called xanthosma. So that looks pretty good. Okay, and your eyebrows are full. Okay, I don't see any problems here. You don't have, okay, any swelling, redness. Okay, your eyes are brown?
Yes.
Okay, great. Okay, any problems with blurring or anything? No. Okay, that's great. And I'm gonna go ahead and just test some of your facial cranial nerves, number 5 and 7. Okay, tell me when you feel something.
I feel it.
Just please say now. You could close your eyes, please.
No.
Okay.
No. No. No.
Okay, that's very good. And can I have you frown? Frown with your forehead. Frown. Good. Can I have you puff out your cheeks? Good. Smile and clench your teeth. Clench, open them up and clench. Very good. The cranial nerves 5 and 7 are intact, but I do want to check your mandibular joint. I want to check for TMJ. I'm sorry. Okay. Let me just palpate. Can you open your mouth? Say ah. Okay, close it. Can you open it one more time? Okay. No problems with TMJ? Okay, that's great, Michelle. Thank you.
You're welcome.
Okay, and now I'm also going to go ahead and do some tests on your ears. Any problems with your ears?
No.
Okay, great. This is called a Weber test. I'm gonna put the instrument on the top of your head. And please, if you could let me know is it equal in both ears?
Yes.
Great, thank you. Now I'm gonna do the RIN test. I'm gonna place this behind your mastoid bone and listen for bone conduction and air conduction. Air conduction should be twice as much as bone conduction. Okay. Tell me when you don't hear it anymore.
I don't hear it.
Okay, now in front of your ear.
I don't hear it.
Okay, that was good. The air conduction was twice as long as the bone conduction, and that's the way it should be. I'm gonna proceed to do some, also with the otoscope. I'm gonna look into your ear canal. I'm gonna bend the auricle back, up and back, and look into the ear canal. Okay. Inside the ear canal, I can see the tympanic membrane. It is pearly gray. I don't see any cerumen accumulation. There's no swelling, no fluid buildup, no evidence of an obstruction. And we'll just go ahead to the other side. Okay, on this side I see the tympanic membrane. It is pearly gray. There's slight cerumen in this ear. No fluid buildup, no signs of obstruction. Thank you.
You're welcome.
Now what I'm gonna do, gonna check your, if you could please open your mouth, I'm gonna check your oral cavity and pharynx. Okay, if you could please bend backwards. Okay. Mucosa, both sides. I'm gonna just use the tongue blade a little bit. It's pink. I don't see any evidence of an infection there. The back, just gonna look back there. The uvula rises midline. Tonsillar pillars are 1+, which is normal. There's a slight white coating on your tongue. If you could rotate your tongue to the right, okay. And now to the other side, to the left, it looks wonderful. And up, the floor of the mouth is the part where there's cancer. I mean, that is the normal part where people develop cancer, so it's very important to check there. It's pink and I could see the veins. Now I'm just gonna look at your teeth, please. Okay, they're all very white. Let's see, upper. I don't see any teeth missing. They are in excellent, excellent condition. And let's see, I'm gonna do the gag reflex also. Could you please pull your tongue out? And can you feel it? Okay, very good, I'm sorry. Okay, so your glossopharyngeal cranial nerves are intact, and the hypoglossal cranial nerve is intact as well. And now what I'm gonna do, could you please shrug your shoulders? Very good. Now shrug against my resistance, very good. And then your face against my resistance of my hand. Okay, the other side against my resistance. Those are the spinal accessory cranial nerve, number 11. It is intact. And I'm gonna have you do, please follow what I ask, range of motion to your neck. If you could put your chin to your chest. Okay, now backwards to the right side and then to the left side, and your range of motion is intact for that. Now what I'm gonna do, just a little range of motion with your arms too. If you raise it and just rotate it a little bit and rotate it backwards. Okay, good. Any pain?
No.
No. And then the other one, rotate it forward, rotate it backwards. Okay, that's great. And let's see, one thing I didn't do, I want to check for pressure on your sinuses. Okay, any pressure on the frontal sinuses here on palpation?
No.
No? Okay, how about These are your maxillary. Any pain or pressure?
Pressure.
Pressure, okay. Do you have sinus problems at times?
Yes.
Okay. And I'm gonna palpate for your lymph nodes now. Okay. These are the preauricular. These are the postauricular. These are occipital back here. The occipital. Tonsillar, submandibular, submental, anterior cervical, posterior cervical, deep cervical, supraclavicular, infraclavicular, and I'm gonna do the axillary right now because it gets forgotten sometimes. Okay, thank you.
You're welcome.
Okay, now I'm gonna go ahead and feel for the carotid pulse. I have to do one at a time. If I do both, I would include the blood flow.
Oh.
Okay. Very good, strong pulse. Okay. And then I'm gonna just, while we're at it, palpate if your trachea is midline, which it is. And, okay. And also, I'm gonna check for the thyroid gland also. I'm gonna, if you could just, okay, your head's tilted. Turn to the right a little bit, please. Okay. And could you swallow, please? Okay, thank you. Okay. It's fine. I'm not supposed to feel it. It's perfectly fine. Okay. Okay, and then what I want to do next is I'm going to listen to your carotids. Just like I palpated, I'm going to listen now, one at a time. And we do use the bell of the stethoscope rather than the diaphragm. It's great. I don't hear any bruits. That would be an abnormality. Now I'm still inspecting your skin throughout the exam. Okay, and I'm gonna palpate your chest wall and chest area. Also, if you could please give me your arms. I'm looking here. Okay, you have some tattoos. They don't appear to be infected. Okay, your skin is soft touch, smooth. I don't see any lesions, abrasions, ecchymosis. Okay, I'm gonna look at your nails. Your nails are rounded. I don't see any fungus or infection. Your nail beds are good, and I'm gonna do capillary refill. Okay, it refills in 3 seconds, which is excellent. I'm gonna do your other arm. Okay, palpate for any masses. Okay, same thing, you have tattoos on this arm. There's no ecchymosis, no lesions, no rashes, very smooth skin. Okay, coloring is good for your ethnic background. Okay, your nails, same on this side. The contour is rounded. Okay, the capillary refill is 3 seconds, which is excellent. Okay, and while I'm here, I'm gonna check your radial pulse. Full and bounding, 2+. I'm gonna check your brachial pulse. Okay, that's very good, Michelle.
Thank you.
Okay. Okay, now I'm gonna go ahead, I'm gonna palpate the chest a little bit. I could just, okay, not too high up, okay. And I'm gonna start listening to respiratory sounds first and then later to the heart sounds. I'm going to do it anteriorly, the front first, then the back.
Oh.
Okay. And if you could take a breath in. Okay, let it out. Another breath. Let it out. Okay, breathe in when you feel my stethoscope. Okay. Very good. And laterally. Thank you, Michelle. Did I tire
You're
you out a
welcome.
bit?
No,
Okay.
not yet.
And what I'm going to do, I'm going to listen to posteriorly now. If I could have you swing your legs so I could view your back. Okay. You could remain sitting in a sitting position. Thank you so
You're
much.
welcome.
Okay, and I will also ask you to breathe in and out when you feel the stethoscope. Sorry. Okay, thank you. I don't hear any rales, bronchi, and the lungs are clear to auscultation. Now I'm gonna palpate your chest wall, and when I put my hand, if you could say 99 when I apply the palmar aspect of my hand.
99. 99. 99. 99.
Okay, now I'm gonna put my ulnar aspect of my hand, if you could say 99 again.
99. 99. 99. 99.
Okay, I was listening to tactile fremitus, which I did not hear, so it is normal. I'm gonna lift up your shirt, is that okay, Michelle?
Yes.
Okay, if you could please help me hold it here. I have to do a couple tests down here. I will, it's gonna be for expansion of your lungs, of your diaphragm. Okay, when I push in, could you breathe deep in? Okay, let it out. Okay, one more time, very good. Okay, and then I'm just gonna do a diaphragmatic excursion, and I'm gonna palpate here when you breathe in, okay, and then one more time. Okay, it's between 3 and 4 centimeters, which is normal. Okay, while I'm back here, I'm just gonna palpate your kidney. It's very good. And I'm gonna inspect your spine. Alignment is normal. I don't see any kyphosis, scoliosis. Okay, your vertebral column is well aligned. And let's see, trying to see your shoulder. Okay, now I'm gonna percuss your back with the percussion hammer, please. Okay. Any pain or pressure anywhere?
No.
Great. Percuss laterally. Okay. Oh, could you please raise your arm or put them in front of your chest? Thank you. Okay, thank you. And now, if you could please swing back over to the other. I'm going to actually have you maybe lie down because I have to do the abdominal exam. Okay, thank you. And I can put a pillow under your head. I'm sorry, a pillow under your legs to make you more comfortable.
Thank you.
Okay. Okay, that's great. Thank you.
You're welcome.
Okay, what I'm gonna do now is listen for heart sounds. Okay. Okay. Okay, this is aortic. Pulmonic. Erk's point. Tricuspid. Mitral. Very good sounds. Apex. Apical. Apex of the heart. Okay, they all sound great. I'm gonna go ahead to look at your abdomen, okay? First, I'm doing a visual inspection of the abdomen. Okay, it appears flat. It's not bloated. I do not see any scars, any lesions, any abscesses. And after we inspect for the abdomen, we go on to auscultation rather than percussion. So I will auscultate your bowel first to see the 4 quadrants for any bowel activity. Okay, you have good bowel activity. I'm going to listen to your aorta. Okay, the renal arteries. Iliac arteries. And if you don't mind, I have to listen to the femoral. Is that okay?
Yes.
Okay. I could do it this way. Okay, they're all intact. Okay. Next, I'm going to palpate your abdomen. First with a light palpation. Any pain or pressure during palpation?
No.
I'm going to do a deeper palpation now. Is that okay?
Yes.
Okay. And then I'm going to palpate for the spleen and also the liver. Okay. Spleen. Okay. Okay, it's normal. I'm not supposed to feel the spleen, otherwise it would be splenomegaly. Okay, and I'm gonna palpate for the liver, the borders also. Okay, the end of the liver border is here, and then checking around, palpating. Okay, your liver does not appear to be enlarged. I don't feel it to be enlarged. Okay, and next I'm gonna percuss with the hammer. Is that okay, Michelle?
Yes.
Okay, thank you. Any pain or pressure on percussion?
No.
Okay, great. It's on the liver. See if I hear anything. Okay, it's normal. Okay. Okay, that part's great. And then while I have you lying down, I'm gonna percuss your brachial reflexes. I'm gonna do your brachial artery for the reflex. Okay, and then if I could just do your okay. Maybe this one more. Okay, I have my finger moved. For the purposes of the evaluation, I'm only going to do it on one side due to time constrictions. While you're, let's see, I'm going to check your pulses also, some of them. I'm going to check the popliteal pulse behind your knee. Good, you have a full pulse, 2+. Your dorsalis pedis pulse. Oh, your feet are kind of cool to touch. Are you usually cold?
My hands and feet are cold.
Oh, okay. Okay, your pulse is 2+. And your posterior tibial pulse. Okay, I'm going to check these on both sides to make sure they're equal over here. Okay, keep you covered up, and I'll check the popliteal pulse behind your knee. And while I'm looking here, I'm just inspecting your skin, your lower extremities, very smooth. I don't see any lesions, scar tissues. There's a birthmark here. I don't see varicosities. You do have tattoos again that do not appear to be infected. Okay. Okay, your nails, your toenails, they're even, they're trimmed, and you have nail polish on them, so I can't really see if you have any other problems. Okay, there's no ulcerations on your feet. Your heels appear dry. Is that normal?
Yes.
Okay, that's fine. Okay, everything else looks pretty good there. Okay, and now if I could please have you swing around and just hang your legs over this way. I'm gonna check for your patellar reflex, please. Feel for the patella here. Okay, that's good. Okay, great. Okay. Any pain anywhere or anything?
No.
Okay. Trying to make sure I didn't forget anything. Okay. Thank you so much, Michelle. I really appreciate it.
You're
and have a
welcome.
very nice day.
Okay, you too.
All right.
Thank you.
Thanks.